Encryption of data is vital for healthcare organizations. Federal law safeguards protected health information, called PHI, which consists of treatment or diagnostic information that can be tied to a specific patient. HIPAA calls for encrypting PHI both at rest and in transmission in two requirements of the HIPAA security rule. The first security rule requirement concerns data at rest. The encryption and decryption requirement is addressable in Federal Regulation 164.312A24. It reads, "Implement a mechanism to encrypt and decrypt electronic protected health information." The second security rule requirement concerns data in transmission. This encryption requirement is addressable and is codified in Federal Regulation 164.312E22. It reads, "Implement a mechanism to encrypt transmitted electronic protected health information whenever deemed appropriate." In addition, the HIT Act of 2009, which enacted many changes to HIPAA, specifically exempts encrypted data from breach notification requirements. As a result, a lost laptop or stolen desktop computer that contains thousands of encrypted health records does not need to be reported to patients or to the government. If the same hardware contains thousands of unencrypted health records, the breach must be reported to patients and to the government, and the provider may face thousands or even millions of dollars in fines. There are two popular strategies for addressing the security of PHI at rest. One is to avoid storing PHI locally altogether by employing cloud technologies. For example, many EHR platforms are now cloud-based, and this software typically does not store PHI locally. Cloud-based EHR software encrypts data in transmission. It also relieves the provider of the need to perform data backups and disaster recovery access, both of which are required by HIPAA. These functions are performed automatically on the provider's behalf by the cloud software. However, for many providers, it may not be possible or desirable to store all PHI in the cloud. For these providers, using full-disk software-based encryption may be attractive. Alternately, the provider may use hardware-based encryption. A variety of software-based encryption solutions are available. In addition, encryption is now bundled with higher-level operating systems. For example, Windows 8.1 Professional and above includes the BitLocker encryption program. In fact, encryption is turned on by default. This software also enables the encryption of portable hard drive and flash drives. Business-class operating systems also provide many other security advantages. Similarly, on Apple devices, OS X Lion and later supports encryption through File Vault 2. One disadvantage to software-based encryption is that it can impact performance. This limitation can be avoided by using hardware-based encryption, where a dedicated processor speeds the process. Many hardware-based encryption drives are available. Solid-state encrypted drives offer especially robust performance. In general, providers should avoid emailing or otherwise transmitting PHI whenever possible. By employing internal messaging through the EHR system, providers can communicate among themselves without exposing PHI through unencrypted email. When communicating with patients, providers should advise them that unencrypted email is not secure. If the patient insists on such communication, the provider should document the patient's authorization. Many providers are implementing patient portals, which are a requirement of Stage 2 of the Meaningful Use EHR Incentive Program that encourages providers to adopt and properly use EHR technology. Patient portals enable secure, encrypted communication between providers and patients. For example, if a doctor sends her patient a message via the portal, the patient will receive a notification via ordinary email. The patient must then log into the portal to view the message. For providers that must send PHI via email, it is vital that the email be encrypted. A variety of secure, HIPAA-compliant email services are available at reasonable prices. These services can work well for communication among professionals.